If you'd asked me when the IOM report came out in late 1999, how much change are we capable of developing and promulgating and absorbing, I would have not have guessed this much. It's really been remarkable, and all of these changes will influence your career as patient safety professionals. Let me simplify what I think this trend line means. First of all, you see a growing business case for safety and quality, one that was non-existent 15 years ago and is quite profound. Today, if you talk to hospital CEOs or boards, they think deeply about the importance of getting it right when it comes to safety and quality, knowing that the payment penalties and the market penalties for not doing so are quite severe. You see a steady progression from what began as relatively weak pressures, social pressure, accreditation pressure with a relatively low chance to fail, transparency pressure with relatively few patients looking up your hospital on Hospital Compare and making a decision to drive across town to another one. Today we have all of the above, transparency, accreditation, social pressure, and now layered on top of that, significant changes in the payment system. Because of these pressures, you now have marked increase in capacity building, which is partly why you are here, new people, new tools, new measures, and the digitization of the healthcare system. We see a transition from what began as a safety movement in 1999 and then became a quality and safety movement in 2001, today being a value movement where really the name of the game is quality, safety, patient experience divided by cost, and the hospitals and health systems that will thrive in the new era are ones that get value right, not simply any one of the value elements. What's particularly exciting about this, and really becomes a subtext for this entire course, is a recognition that in the beginning of safety and quality measures, it was probably fine to treat some of these as one-offs. Okay, they're measuring us on did we deliver discharge counseling to a patient with heart failure. We'll go ahead and hire a few people to tap the doctor on the shoulder to make sure that he or she did that, or in fact, they'll deliver the discharge counseling themselves. You could do that when there were 5 measures or 8 measures or 12 measures. You can't do that when there are 100 measures, and the measures span the range of value from quality to safety, patient experience, access to cost. You really do have to remake the entire system and reimagine the system and figure out new ways of organizing teams and new ways of using data and new ways of changing culture. And that's really what's so exciting and challenging about today's current era.